Talking about the different rationales of psychotherapies, it can range from the emotional therapies, the group therapies, and then we have the family therapies that can be devised just to help the patient come out of that particular kind of a psychological ailment or a problem that he's or she is suffering from. So, how do we basically range patients, whether we are going to devise an emotional, a group therapy, or a family therapy, depends upon the causative agents that can contribute towards the worsening of the symptoms in a particular patient. So then we want to decide this particular kind of way or this particular kind of treatment that we're talking about. Till now, we are just discussing the verbal forms of treatments that can be devised for the treatment of the psychological ailments in this particular patient that we are dealing with. So this is basically how you go about and treat patients in this way. Over here in this section, we'll be defining, first of all, a kind of a treatment which is known as group therapy, and then we'll be following it with the family therapy in a lot of cases. And then we have the different goals that have been set by the psychiatrist or the physicianist just to carry out these therapies, and what are the outcomes that you're expecting as a clinician, as a practicing psychiatrist, when you're dealing with these kind of emotional therapies that you have on your hand. So the rational emotive behavioral therapy, it is basically known as REBT. So this is the abbreviation that is usually given to these kinds of emotional therapies. Again, it's basically a form of a verbal treatments that are being carried out for this purpose. And then we have the cognitive behavioral therapies, in which the clients are directly challenged in their irrational beliefs and helped to restructure their thinking into more rational belief statements. So this is basically, in other words, you can say that we are giving an insight to the patient towards his problem. You are giving reasons for the rational beliefs rather than the irrational beliefs or delusions or even the hallucinations if he or she is suffering from. So giving the insight to the patient if he's suffering from some sort of paranoias or schizophrenias, giving that kind of a treatment, you're basically empathizing with the patient and you're reflecting towards his thoughts and delusions. So this is what we are catering on when we are carrying out this rational emotive behavioral therapy, also abbreviated as REBT. So what are the advantages when we talk about this REBT is that it treats depression, stress disorders, anxieties, phobias in a lot of cases, and then it is basically criticized for focusing on the symptoms, not the causes of the disordered behaviors in a lot of individuals. So what are the characteristics over here that we can talk about? We have the psychodynamic therapies that we can go about and treat. Now, giving an insight is the goal that we have at our hand when we are treating these patients who are suffering from some sort of medical ailments or some sort of psychological ailments. Aims to reveal the unconscious conflicts through the dream interpretation and free association, resistance, and transference is sometimes observed in these kind of treatments. Then we move on to the humanistic therapies. Now we have two models or approaches towards that. One was the Robertson-Pearson-centered therapy, and the other one was the Gestalt's therapy. So again, the goal over here is just to give an insight to the patient. Non-directive therapy, the client does most of the talking. Key elements are authenticities, unconditional positive regard, and empathy. Directive therapies, therapist uses the leading questions and role-playing to help the client accept all parts of their feelings and experiences while he or she is carrying out these humanistic therapies in these individuals. So then we have the behavioral therapies on the other hand. Now over here, the goal is to have an action on that. Rather than giving an insight, you have an action. It is based on the principles of the classical and the operant conditioning, aimed at changing behavior without concerns for the causes of the behaviors. And then we have the cognitive behavioral therapies, also abbreviated as CBTs or REBTs. And this is, again, the goal over here is just to provide an action rather than just giving an insight, and action is also provided in this case. So the methods are, the aims is to help the clients overcome the problems by learning to think more rationally and logically. So the aim over here is to make the thinking of the patient more rational and more logical, and it can only be done if there is a two-way talking or the communication skills are quite good with the psychotherapist. So the clients are challenged in their irrational beliefs and helped to restructure their thinking or their thought process, and thought form is also restructured after this sort of cognitive behavioral therapies or REBTs when they're carried out. So these are the different kinds of therapies that we have to keep in our mind when we are choosing from a range of therapies that are only verbal on their kind. And right now we're not discussing the pharmacological therapy, it's just the therapies that are of the verbal kind or the talk therapies that we're talking about. So the family therapies, now what is the goal over here? The goal over here is just to treat the families as well, or just to give an insight to the families as well. The family members meet together with a counselor or a therapist over here to resolve the problems that affect the entire family of the person who is suffering from the psychological ailments. So psychological ailments are one of their sort where the families are also affected deeply, and sometimes they also start suffering from depression, anxiety, and phobias, hallucinations, delusions, just by living with a person who himself or herself is suffering from a certain kind of psychological ailments. Mostly the intimate relationships are mostly affected through this kind of a behavior. Usually the wife or the parents of a child who's affected can be affected mostly due to these psychological ailments that we're talking about over here. So what are the types of the group therapy? First of all, we have the self-help group or the support group. Now a group which is composed of people who have similar problems and who meet together without a therapist or a counselor for the purpose of discussion, or it can be for the purpose of problem solving and social and emotional support. So these are the factors that are to be present. It should be a group which was just formed for the therapies of each other, just giving a way of catharsis or giving a way of talk out or the verbal treatment that is provided not by a counselor or a therapist in this case, but people suffering from these same disorders, or the people suffer, or the people who have gone through these kind of psychological ailments or have been through these kind of conditions in their life. They sometimes provide the conditional support, or the unconditional problem-solving techniques are sometimes devised in these cases of the group therapies that we talk about. So when is the group therapy useful? The group therapy is most useful to persons who cannot afford the individual therapies and may obtain a great deal of social and emotional support from the other group members. So this is the certain kind of circumstances where the group therapies can be devised. The advantages are that it is a low cost, the exposure to the other people with the similar problems, social interaction with the others is also encouraged, social and emotional support from people with the similar disorders or the problems is sometimes given for that. Then we have the disadvantages. Now, the need to share the therapist's time with the others in the group, lack of a private setting in which to reveal concerns, and inability of people with severe disorders to tolerate being in a group. So these are some of the disadvantages where the group therapies cannot be done or cannot be performed in a lot of cases. So over here in this section, we discuss the different types of the psychotherapies, as well as the family therapies and the group therapies that are sometimes quite useful, and they have their own advantages and disadvantages. So that is the end of this section. Thank you for watching sqadia.com.